Welcome to the RSNA 2021 at the Shimadzu Medical Systems booth. I'm Charles Casadakis, the RF and RAD Business Director. I'm pleased to be able to show you our RadSpeed Pro system. RadSpeed Pro is a system that's been installed in many hospitals and clinics worldwide. It has a foundation of reliability and durability, just like all other Shimadzu products. But this year we're highlighting something very special. It's our Power Glide feature. Power Glide is a power-assisted mode that when you press the sealing tube mount, it actually moves with your hand very easily because the motors help assist the motion of the arm to get it in place wherever you need to for being able to start to do your exams, the techs to do the exams. What makes Power Glide so special is that this is one of the items that's part of what we do for the entire system. It actually minimizes the risk of injuries to patients and also to healthcare workers. And the reason for that is that handling patients and being able to do repetitive motion all the time on systems like this can cause injuries, both to the patient and to the tech. So it could cost hospitals as much as $15,000 to $30,000 per year in being able to manage patient safety and also healthcare workers that miss work as well. So for that reason, we use Power Glide and ergonomics to help reduce those risks. So on top of that, not only do we make it easier for the techs to move the system, but we also work on ergonomics so that if they're working behind the system or if they bring a stretcher in, we have buttonology behind the sealing tube mount that actually allows you to move it, that actually allows you to be able to guide it when you're behind so that you're not reaching over the system and straining. The tech doesn't strain and become injured. On top of that, we can move the table very low. As you can see, we've got our table positioned very low so that when patients have to get on the table, they can actually easily get on the table at this very low height. And on top of that, we have a very flat tabletop with no ridges. Again, all to make it easy to move patients on and off the table. For these reasons, the RadSpeed Pro is a solution of choice throughout the world of a system that will do what really needs to be done in a RAD room, but on top of that, minimize the risk to patient injuries and to healthcare worker injuries. Here at RSNA 2021, we are also highlighting dynamic digital radiography. We call it DDR. DDR is pulsed X-rays that can go as high as 15 frames per second and can capture as many as 300 images in 20 seconds. And it shows motion, particularly in terms of respiratory in the lung. You're able to see the diaphragm moving up and down. You're able to see the lungs expanding and contracting. And this helps clinicians be able to see not only anatomy, but also function. What's important about that is that we've seen a collaborator who's utilized this in particular to try to, help them with looking at pre and post lung transplant patients to see if the diaphragm is weak or if it has paralysis. And in this case, they can do additional diagnosis just from a chest x-ray. On top of that, we also have the orthopedic portion of this solution. And that part basically shows the movement of joints, flexion and extension. Normally you see one, then the other, and then the orthopedic surgeon has to make decisions from what he's seeing in two static images. With DDR, you could see the entire range of motion of flexion and extension. And in that way, the orthopedic surgeon can start to determine what is the symptoms or what they need to do to help these patients because they're able to see the full range of motion. Next, I'd like to highlight our MX8 mobile system that's here at the RSNA. It's very easy to maneuver the MX8 with the tube head. You could grab it at many points to disengage all the locks. And we call it Glide View because it's like gliding on air when you move this. Very easy to move, even with one hand. On top of that, you can park it so low that your field of view is excellent to be able to see in front of you. That's the Glide View part of it. And our mast, our collapsible column, is about 50 inches off the ground. So that low profile makes it easy to maneuver in tight places. On top of that, we also are able to adjust the handle with our adjustable handle, either low or high, so that it meets the right height for the technologist. On top of that, this year we highlighted a works in progress AI solution. On that solution, we're able to look at images that were taken right after surgery, and then the AI highlights either needles or gauze or sutures in a way that the surgeon can quickly see if they've left any items behind from surgery. It's an exciting application for AI. It's a work in progress, but we continue to look forward to the progression of that product. So if you weren't able to join us at RSNA, I'd like to thank you for your time in viewing these videos, and hopefully you'll see that Shimadzu Medical Systems provides value and solutions to our customers.
Shimadzu, we care for you.
Excellence in science. Shimadzu.